Janice, how are you doing? This is the scary part about turning your camera on. I
Doing
usually call you
great.
out and say,
I
hey,
know.
what's
I was
up?
like, wait, I thought I was unmuted. Doing great. How are you guys?
Doing good, doing good. It's
I just
gorgeous
got,
up here. All the leaves are starting to change and stuff. So
and it's, yeah, as you can tell, it's fall, which is super nice.
yeah, it's really nice.
I just got back from the Dominican Republic. Nothing fun. It was for my son's judo tournament, and I brought back a very unfun friend with me. So when you travel, don't eat or drink anything that
Oh,
doesn't
yeah,
come in a little box.
yeah.
All
That's
I
so
did was eat a
interesting.
salad. That's all I did is eat a salad.
Gosh.
That's all it took.
Yeah, we have so many people that I've talked to recently that are going to the DR to vacation. Like a lot of our colleagues here actually live there or have houses there. So
Oh, wow. We couldn't leave our hotel, so we were
oh,
definitely in the bubble.
so how
But
did he do in the judo tournament?
he did well. He placed 7th out of 16.
Wow.
As a mom, I feel that there were 2 of the matches that he should have won, but the
Of
ref
course.
definitely sided with the Dominican, and I have the video to prove that he should have won, but I yelled Spanish very loudly. I probably should have stayed quiet, but I can't. So
Yeah, you don't want to make people mad at a karate tournament or a judo tournament. It's usually not
you
the wisest
don't,
thing.
you don't. But then they're looking like, you speak Spanish? I'm like, I sure do. So watch out.
Oh, that's interesting. All right, well, thank you everybody for joining. We're going to give it, like I said, maybe 2 more minutes just to make sure everyone can get on. I see we're up to about almost 50 people. While we wait, I wanted to let people know we've gotten an idea for the next idea workshop, which again, it's really selfish because it's come up here a couple times, which is how do you, we've dealt with before integrating research into our clinics on idea already, but there's a more specific question that we're learning a lot about, which is having to do with the databases and consenting, and there's all kinds of interesting controversy and IRB versus medical records that we have a couple places that have implemented more of a global universal consenting. And my gosh, if we can get all of our centers to do this, it would be really cool. So I'll put that out as the next topic, and then we'll invite a couple speakers in to talk about what they've implemented at their centers that you might want to implement at yours in some form or fashion that kind of helps integrate your clinic database with your research database. So even if you're not a researcher, it's cool to have because it's just basically you'd have a registry basically of stuff that you can look back on that can help your clinical flow as well as your research. So, and thank you to Rebecca Keene for that idea because it's actually very, very timely and relevant. But let's go ahead and get started. Looks like we have about 60 people on. Okay, so when this topic was recommended to just talk about like how are we handling transgender. And handling is like, again, I'm very aware of the words I use these days because I don't want to be insensitive. So I don't even like handling is the right word, but how are people just dealing with the topic of transgender and how it intersects with autism? So when I put that out there to the group, I said, well, who should we get to talk about? Like I do usually, do any of you, like, have you dealt with this? Have you integrated this? And if so, would you be willing to speak? And everybody came back and said, you need to get John Strang to talk. You need to get John Strang to talk. So it came like about 4 different people, 5 different people said, you got to get this guy. So we reached out to John, and John very graciously agreed to give the presentation today. And when I learned a little bit more about him and what his expertise in the area, we just decided, let's just give him the full 45 minutes. He could probably talk, I would imagine, for a full day on this topic, right, John? But what we're going to do is limit it to like 45 minutes, 50 minutes, and then save some time for some questions that we might have afterwards. So John, thank you so much for giving your time and expertise to this group today. I appreciate that. And go ahead, Melanie, do you want to hit the record button? And with that, John, I'll pass it over to you.
Thanks, Stephen, and thank you all for showing up today. It's interesting, I give talks on the intersection of autism and gender diverse identities to very different kinds of groups of people. And so I often have to remind myself when I'm entering into this, am I speaking to autism people or am I speaking to gender people? Because the worlds have been so separate. And one of the goals that I've had is trying to walk in both worlds at the same time and then start to build some of those connections. So I hope today will be a bit of that for you. And I know that your group was founded, at least in part, to talk about autism diagnostics in complex times. So I thought I would talk a little bit about diagnosing autism in gender diverse folks, and also some of the clinical complexities. I am the director of the Gender and Autism program at Children's National Hospital in DC. And I believe this is the first and still only subspecialty program dedicated to the co-occurrence of autism and gender diversity, though there are other initiatives internationally that are developing. And I'm also part of the Global Education Initiative for the World Professional Association for Transgender Health. For today, I do have one possible conflict of interest. Actually, I think it's not possible. I think it is a conflict. And that is that I'm going to tell you that I'm recruiting for a funded study of autistic transgender young adults. And my lab receives funding for this project. And so with that conflict of interest, I will just flash this flyer by your eyes. We're looking for 18 to 35-year-olds across the country, across the US, who are autistic and gender diverse in some way. And it's a pretty easy study for them to participate in, and I think we can send that flyer out to your listserv later. So when I started this work, I feel as though this was a very lonely time in my professional life, because it was not such a popular topic in the autism world or in the gender world. In fact, I had parents of transgender youth saying, yes, I know that a lot of the kids are autistic, but you talking about this is actually making life worse for transgender kids because it's pathologizing transgender identities. And that was a very painful experience, especially because viewing autism as something that would be a negative mark on the transgender community felt very different than how I had understood autism in my life, as something of neurodiversity and neurodivergence, which can sometimes be great disability. So I felt that I needed to partner with people who had lived experience in both of these worlds. And this is just 5 of the people who have helped guide us over the years, really exceptional advocates, thinkers, people with lived experience of being transgender and gender diverse. And there are many more, but I just wanted to start with this slide to say that a lot of our work comes from our collaboration with people who have actually lived in both worlds. The Gender and Autism program has developed over the last several years, and now we are a multi-specialty clinic. It's really amazing to me how many people are involved in care. And we also have a wait list for autistic transgender people that's almost a year long, just from the DC area. So there are a lot of these kids, and there's a lot of need for service, and it's multidisciplinary service that's needed in many cases. This is a timeline of how we got started. So Children's National founded one of the first gender programs for youth in the United States in 1997. And back then, families would come in. It was offered in the evening because there was a lot of worry about safety. And there was privacy, there were many privacy issues. And so families would come in, but not a lot was made of the program back then. In 2009, I was invited while I was still in training to be an autism specialist, because so many of the kids coming through the gender program were on the spectrum or suspected of being autistic. And then in 2011, with my fellowship, we started an informal neuropsychological service for autistic gender diverse youth, and started to see a lot of these kids just coming through clinic and neuropsychology. So conversations were happening with autism specialists and neuropsychologists about these kids. We didn't know what we were doing, though, and we were really trying to learn how to help families and give some kind of clinical direction for young people. And so in 2015, we did a study, an international study, identifying all of the providers internationally who had done considerable work in this area, who had seen a lot of autistic transgender people. And they came together over a 2-year period to come up with an initial set of clinical guidelines for autistic gender diverse adolescents. It's interesting that that publication is now the second most read article in the Journal of Clinical Child and Adolescent Psychology. I think that is a sign of how important this topic is to a lot of people, that that was the first clinical document related to this care. And then in 2017, we officially founded our program, a clinical and research program. And in 2018, there was such a need that we included 2 neuropsychologists and 2 speech language specialists. And then finally, in 2019, we launched our psychology training program for psychologists who want to specialize in the co-occurrence. And so just a little bit about how our clinic works. So we provide evaluations, and for evaluations, we think about autism, diagnosis in some cases. Some of our young people come with well-characterized autism, but there's been a question that's been lingering for years. Many of our young people are coming in for gender-related needs and questions about hormones, or even gender-affirming surgery. And so we think about issues related to medical readiness for progressing with those kinds of treatments. We also do a great deal of consultation with community providers because we have so many patients and we can't provide that ongoing individual therapy. So we do training with those providers who may be autism specialists, but are often gender specialists who often know very little about autism. We also do training with medical providers who are trying to help autistic patients through the medical transition process that many transgender people undergo. And we have an ongoing support program. It's been ongoing for 4 years, a youth program, and then a parent program, and now we have a young adult program. And I'm really proud of our speech language supports. We have 2 speech language pathologists who are trained in autism, and they're also trained in gender voice, which is so rare to have both of those specializations. And that's been really helpful for our autistic transgender youth. So just a tiny bit of history. In 2010, there was the first study of co-occurrence rates of autism, and this was from our Dutch colleagues. We partner with them on many projects because they've been thinking about this for a long time. And then in 2014, in our program, we looked at this co-occurrence from a different perspective. We looked at the rates of gender diversity in an unselected autism sample and found a significant overrepresentation of gender diversity. There have been much more ambitious studies since then. I'll just mention the largest study to date, which was published in 2020 in Nature, one of the Nature journals. And this involved about 650,000 people across 5 different recruitments internationally. And across these studies, most of the studies were finding the rates of autism among transgender adults were more than 6 times greater than rates of autism in cisgender adults. There is also evidence of an overrepresentation of gender diversity in adults on the spectrum, and there are 3 studies so far, and those rates are difficult to interpret because studies are done in different ways, but they've ranged from about 10% to 13% of verbal autistic adults reporting some level of gender identity diversity. Again, that's an early research field there, so those numbers, that's what's been reported in those studies, but difficult to interpret. There are a couple of other interesting studies that I wanted to highlight. So the large Australian study of transgender youth found that 22% of these trans youth had been diagnosed as autistic. That's a shocking number. And they've done some additional work looking at the profiles of those autistic transgender youth, very concerning in terms of mental health and psychiatric challenges. And then I think in the most interesting of the studies so far, from our US medical database of kids of service members, this was in almost 300,000 youth who were in that database. Gender dysphoria was 4 times more often diagnosed in autistic youth. So research is burgeoning in this field, but we also have community expressions of the co-occurrence, and I think that those are equally important to learn from and to listen to. And so some of you may know this documentary of the life of Martine Stonehouse, who was an autistic transgender woman in Canada, who really changed the world for Canadian transgender people in her advocacy for transgender rights. And in this beautiful documentary about her relationship with her autistic boyfriend, it comes up that she feels that her autism helped her to stick with that advocacy during many years when it was difficult to talk about these topics. So I think that film is available these days on Amazon. And then a couple of years ago, there was a joint statement made by the Autistic Self-Advocacy Network, the National Center for Transgender Equality, and the National LGBTQ Task Force on the intersection of autism and gender diversity and the rights of people who have that intersectional identity. And I should also note that there are many autistic gender diverse advocates who are well known in transgender and sometimes autism circles and advocate on behalf of people who are at the intersection of these two identities and experiences. And then finally, some of you may be familiar with the Autism Women's Network, which recently changed its name to the Autistic Women and Non-Binary Network. And that was in direct response to the many members who were themselves identifying outside of cisgender identities. Okay, so I'm going to share with you today some published research and also some of our research that is not yet published or not fully published from some of the projects that might be of interest to you regarding diagnosis to start. And so this was from my case study, which is kind of developed through our ACE network as well into a much larger initiative. But in this study, we wanted to understand, at least in part one, whether the diagnosis of autism in transgender people was really the kind of autism that other people were seeing. There was a suggestion that maybe these transgender youth are not autistic, that they appear autistic because of gender minority stress or something about the experience of being gender diverse in this society. And so in this study, we wanted to look at autism diagnosis using the best gold standard approaches that we could with a transgender selected group. There's also a neuroimaging aim of this, which I'm not going to talk about today, but that is some extra data that we'll be publishing hopefully soon. So in this study, we had a clinic and community recruitment of transgender young people between the ages of 13 and 21. And we picked that age because for autism, that's when we first start to see a lot of these autistic gender exploring kids coming into clinic. If we had gone younger, then we probably would not have seen so many of the autistic youth. And in many samples of gender diverse youth, we have a weighting toward transgender young men. These are people who are assigned female at birth. It's been published on in multiple studies, and that was, we did feel that pull in our recruitment. We tried to even our groups through a purposive sampling, and we did the best that we could, but it was still more young men than women. And in this study, because of the neuroimaging, we were not recruiting other genders, just transgender, binary, male or female. And so here's some of our data, which is published in our recent 2021 paper and the supplement to that paper. And so in terms of concern for ASD or developmental disability, when we look at the male identity versus female identity, so for trans males, these are people assigned female at birth. For trans females, this is people who are assigned male at birth. We do see a significantly later age of concern for ASD in the trans boys. Those are people assigned female at birth, which maybe is mirroring that pattern that has been suggested by some, that there are girls on the people assigned female at birth who are identified later, that there may be more subtle signs earlier, although that's a very controversial topic, I know, and Eric Fombonne has concerns about that from his recent piece that he published on this topic in Camouflage. We also see that the ADI social and communication scores, so from those early years, these are standardized across the sample because there's really no way to combine them just as raw scores, that there were more early social symptoms for the trans girls, people assigned male at birth. And then if we look at the DSM-5 clinical rating of restricted and repetitive behaviors from the past, we do not see a difference between the groups. And this really does ring true for us, that the RRB are often reported from an early age, but the social profiles of trans boys versus trans girls on the spectrum seem to follow the sex assigned at birth patterns that many of us are seeing in our clinics. And so in this study, I'm just going to fly through this, I'm sorry, just so that you get a taste of this. We recruited across different subgroupings because here's another issue that's come up in our field. It's not just an overoccurrence of people diagnosed on the spectrum who are transgender, but it's many youth who have a lot of the qualities of autism are kind of bumping up against the diagnosis. Maybe it's been suspected that they're autistic for many years. And you might see two people who say, yes, they meet criteria, but they're right at the edge. And then two other providers, well, they're below. I can't really diagnose autism. I don't really have another diagnosis. And so that subclinical autism quality in transgender clinics has been described clinically. And I think now we're starting to see that in research. And so in this study, we recruited across people who were diagnosed, suspected, and where there was no suspected ASD. Of interest among our trans girls, it was very hard to find trans girls. And we worked for 2 years at this where there had been no suspected autism. That's a difficult finding that we have worked with and worked with our community advocates for a while to think about how to present that or understand it. But a great deal of work was given to recruiting trans girls in this age range where nobody had brought up the question of autism. And so I won't go into detail here, you know these measures, but we did the ADOS with research reliable coders and had a team recode 15% of the administrations with 4 independently research reliable ADOS coders. We also had consultation for these administrations with our speech language pathologists to make sure that the transgender voice atypicalities weren't coded as autistic, because some of these kids are really working to change their voice and that could affect some of the coding. We also had ADIs all given by 1 research reliable coder, and we gave extra coding for any gender related content and made sure that anything that was gender related in RRB was not counted, because gender related needs might appear like RRB. So we took a very conservative approach. We followed up with interviews, and we also, in some cases where there was a blurriness, we reviewed videos of the early years to look for those ASD signs. And so the approach here was to use the instruments, but really to rely on the gold standard, which is the DSM-5 diagnosis of autism. And so here are our outcomes. In our diagnosis of autism, we saw that 13 came in with a diagnosis, 10 had suspected, and then this is in the trans girls, only 5 had no suspected ASD. And in the outcome, we had a net gain of 3 autism diagnoses. 8 were at this marginal autism classification where they met, for example, all criteria except for 1. And then one of the people who had not even been suspected of autism was diagnosed on the spectrum. So in total, 5 new ASD diagnoses. We found 1 optimal outcome where they met in the past but had made gains. Don't love that term, but that's what we're using these days. And 1 autism diagnosis was disconfirmed. In the trans boys, it's a different picture. We had much more of a distribution across the different categories, which rings true that a lot of the trans boys coming in, there's no suspected autism and none of those traits. And in this group, the outcome was 5 new autism diagnoses. Interestingly, 3 optimal outcomes in this group, 4 were difficult to place due to trauma history and other psychiatric conditions. And I think the final thing is that all with no suspected autism at baseline were found to be non-autistic in the end. And so a few summary comments I'd make from these findings. First, it was difficult for us to identify and recruit non-autistic trans girls. I don't know if that's where we were or the time or what, or something that's underlying that group, but that was very challenging to us. There were 10 new autism diagnoses made out of 66 transgender youth. Many of the youth showed early signs of autism before age 5. The subthreshold autistic category appears relevant in the diagnostic process. And it was rare in our study to find that gender diversity was suggested by parents to be an over-focused interest. There were only 2 parents who brought up gender-related RRB. We did not find any clear evidence for the pseudo-autism that had been described by some people who had mused about this and wondered whether that was the case. Only one of our autistic participants appeared misdiagnosed as autistic. And so I've created this figure here, which is really, it's a clinically driven figure informed by some of the research that you've just seen for how we think about autism in the trans clinic. So clearly there are a lot of trans folks who are not autistic. They have nothing to do with autism. That's the majority of trans youth. There is then a subset of youth who seem to have these broader autism phenotype characteristics. And then it seems that there's another category that goes beyond that, where it's these kids who are almost at the autism diagnosis, and there's a clinical impairment, and we need to talk about autism-related supports, but they're not quite meeting those criteria that are currently defined as autistic, and then a good group of people who are meeting full criteria for autism. I'm going to share this. This is not published, but we've recently done some work with our database at Children's National. This is our clinical database for autistic diagnoses. And this is the age of diagnosis for people who are cisgender male, cisgender female, or gender diverse. And I'm sorry, this is the heterogeneous group of all people who are gender diverse. And this is when they were diagnosed as autistic. And you can see that there's a significant difference in the age between the cisgender kids and the gender diverse kids. And I could speak with you for many hours about what might be contributing to this. I'll just say a couple of words. One piece is that for gender diverse youth, there's often so much focus on the gender, and providers in the gender world would understand social differences as, oh, this is a kid who's experiencing gender dysphoria and really struggling socially, of course, for that reason. This is a very common narrative in our clinic where the parents say, you know, we were working with gender in those years and trying to get our kid to be okay. And then once our kid got to the place where they got the gender supports and like that's under control, then those social differences, they just never stopped. And so we now are making a stop to the autism clinic. It's not that the social differences weren't always there, it's just that they weren't contextualized within the autism definition. And then when we go back and do those ADIs, the kids are meeting criteria for autism in the past. So that is one common trajectory for us. I would also say that many of our kids, even if they're over the diagnosis of the autism line, that they are still close to that line. And these tend to be kids with 120 IQs, super verbal, and kids who would often be missed in clinics anyway. So that's another aspect of the profile that's emerging. Lots more that could be said about this, figure, but we won't dwell here because there's more to do. So moving from diagnosis to inner experience, this is a project that is a longitudinal qualitative study that we did with autistic transgender adolescents. And we followed them over time to understand what was important to them, what were they struggling with, what did they need from us. And there were a number of themes that emerged. And so I'm going to share with you a little bit of the qualitative themes and some quotes from the kids to just give you a taste of what we learned from them. So first of all, almost all of these kids talked about urgent gender needs. Some people who have been a little distant to this population have said, oh, this is over-focused interests. You know, this isn't a true gender dysphoria. These probably aren't transgender kids. And who knows, you know, long-term what their outcomes will be, and none of us can speak to that. But we were hearing from these kids really emotional descriptions of their gender dysphoria. So this is a trans young woman, autistic, diagnosed young. And she said, I feel absolutely disgusted by how tall I am, my genital area, my body hair, my voice, my face, my hair, my skin. Can I just say everything? What was interesting to us about quotes like this was that many of these kids were not big in terms of emotional expression. And they actually offered very little information about inner experience, but when it came to gender, they had a great deal to say and really intense emotional language. So it seemed to break through that kind of autism barrier of communication around feeling states. And so we also heard of long histories of gender where autistic youth had experienced things but didn't have a vocabulary for talking about it. And so this is a quote from another autistic transgender young woman who described years of exploration but not really talking to anyone or showing anyone anything about this. Of course, when she finally came out, the parents were shocked and didn't believe her because there had been no sign. So she said, definitely in middle school, I was uncomfortable with being male. And I don't think I realized it as such, but it was very much happening. But I didn't know that there was much to be done about that until like middle of 6th grade. And I started becoming interested in, and by the end of 7th grade, I was very much in the camp of, I'm not about this, and thinking that I wanted to be trans. By 8th grade, I was fully cognizant of not wanting what was happening to happen. Someone had a huge crush on me in school, and it was super uncomfortable being in a male kind of role. High school was horrible, and I wanted to come out every day, and I thought about it every second. And then one day I came out, and that was that. And so when we looked at these ages of recalled gender histories, although these kids were getting to us in their teen years, many of them had been thinking about this from elementary school. A majority of them had been, and yet there had been no signal given to anyone else. We had also many youth talking about the impact of neurodiversity on their gender journeys. So I'll read these words of an autistic transgender young man who said, "It is a paradox of self-awareness because autism, I think, makes you less aware of your emotions. And to know that you're trans means that you have to be incredibly cognizant of your own mental state and your identity. So it's difficult for that reason. And it's difficult to plan for all of the sort of details and process of being trans, like getting appropriate treatment, changing documents. Talking to people about getting accommodations, like getting the bathroom at school, is more difficult if you're on the autism spectrum." And then one of the other themes, and the final one that I'm going to share with you today, is this theme that we hear about a lot, that my gender has been questioned due to my autism diagnosis. And this comes from an autistic transgender young woman who struggled so much to get to our clinic because no one believed her. And she said to us, they viewed it as an obsession, but it's really not the same thing. And I don't know how they thought that. Now, it's complex because we do know that gender histories and identifying who you are in this world can unfold over time, that the gender journey can be complex, and that's true for people who are autistic and people who are not autistic. So we followed these young people, and this is a small sample of 22, but we followed them over 2 years to see what was their trajectory. And over those 2 years, we saw intensification of gender affirmation for 6 of those 22 youth. We saw 12 of the youth really staying in the same place. Many of them had already been affirmed fully and were out. That's what that means. Maybe moving forward with medical in some cases. 4 of the youth, though, showed an attenuation of gender diversity over those 2 years. And of those, 2 of them had requested medical treatment. And so this is an important number to realize, wow, if these are irreversible treatments, how do we make those decisions when kids may be changing over time? And there is also a time urgency around some of those treatments. So there are developmental windows where if the treatment isn't given, then the body is going to masculinize or feminize. So a lot of stress around those kinds of decisions. What's interesting about this is that we've continued to follow these youth, and this is not published, but I share this with you because I think it's an important addendum to that study. And 2 of those 4 youth showed an increase in gender-related need over time and are back in our program. And so the gender journeys are complex indeed. Okay, I'm hearing some sounds. I think those might just be background sounds.
Yeah, and I'm trying to mute them as they come up, so.
Okay, sounds good. All right, so just to kind of give you a taste of lots of different things today, it's different topics. I wanted to talk a little bit about how autism profiles may be related to assigned sex and gender in different ways. So in our recent study, this is our 2021 study on mental health in transgender and autistic transgender youth, we looked at internalizing and suicidality. And what we found is that in terms of internalizing, we were really identifying that being transgender and autistic was associated with the greatest internalizing. But in terms of suicidality, we can see that actually gender, and this is gender identity, not sex assigned at birth, but gender was an important predictor here, where cisgender autistic girls and transgender autistic women had the highest rated suicidality. What's interesting about this is if you think, well, a transgender autistic young woman is, before they came out, they were a cisgender autistic young man. And so that group, but they're at the opposite ends of the spectrum there in terms of suicidality. Now, you might also argue, and we talk about this in the paper, that there may be other reasons for transgender autistic women to have higher levels of suicidality that may not just be about gender. But what is interesting to us is that here the cisgender autistic women and the transgender autistic young women are the closest together in terms of their suicidality risk. We've been thinking a lot, because we do this at Children's National, but also because it's important, about executive functioning. Of course, executive functioning referring to the planning abilities, the ability to think flexibly, organize, and initiate in the world. Well, if you're transgender, or if you're a young person, what could be more of an executive function challenge than transitioning your gender? That's a huge challenge. It's already hard enough to be a student, to be transitioning to adulthood, and then to add this huge thing of navigating how to come out to family and friends and teachers, how to get the care you need with the time ticking during the teen years while the body is changing. It's a huge executive function demand. And for autistic people, we know that many autistic people struggle with executive function skills. So we wanted to understand a little bit about how executive functioning might be interacting with the gender needs and gender journeys of these youth. And it was interesting also, you might remember that quote from the qualitative study where the trans young man said, it's all of these things like getting my name changed and navigating all this. It's much harder because I'm autistic. I'm going to share with you, some of you may know the Ray Ostrich, some of you may love it, some of you may hate it, but it is what it is. And so here we gave raise to a lot of transgender youth in the case study that I gave, and spent an entire summer scoring raise, which was painful, but interesting. And so here we used the multicolored pen administration so that you can see the construction of this figure. For those of you who are not familiar with the Ray Ostrich complex figure, this figure is presented to the individual and they have to copy it, and they are able to look at the figure. It doesn't really look at anything, so there's a great organizational demand here, of course, also a visual processing demand. And then the figure is taken away and they have to draw it from memory. In this case, though, we're going to look primarily at the drawing, and then you'll see the immediate recall, which is immediately after what they remember. And so this is a non-autistic trans young woman who drew this, and the sequence of pens was green and blue. And she had a very efficient approach drawing the outside rectangle and then these diagonals. You can see there's a Gestalt approach to that drawing, and then moving to the blue pen, and we get a nice, pretty coherent box there. But overall, a very Gestalt organized pattern. She only needed to move to the black pen. Each pen is changed, I believe, every 30 seconds or maybe 45, I can't remember. And so she didn't even need all the colors. And then when the figure's taken away, because she had that kind of underlying organizational Gestalt, she's not autistic, she did a really nice job of getting the big pieces of this figure copied from memory. And so this is an autistic trans young woman, and we see a very different drawing of the ray. This may be very familiar to those of you who are neuropsychologists, this parcellation and, for example, breaking these lines here into individual triangles. I think this is interesting, the pulling out of that triangle here and so forth. And so then when we ask her to remember the figure, there's very little there of the gestalt. And so with this and the descriptions that we received from our qualitative work, we developed a series of questions about how executive function might affect the gender needs and goals of gender diverse autistic youth. And so these were 5 questions that we developed with the young people. They co-developed them with us, really capturing things about flexibility, how this creates a flexibility challenge, the communication aspects of executive function, working memory, remembering to work toward the gender goals. That might be things like remembering to put on your dress or to put on your makeup or to take your medication, and even just planning the steps for how to move forward. And so when we looked at predictors of internalizing and suicidality, not surprisingly, this is a finding that is really universal across studies. The experience of perceived stigma, this is in 66 transgender youth, about half of whom are autistic. The experience of perceived stigma was a significant predictor. Social autism symptoms, this is ADOS scores, was also a predictor. And these executive function gender barriers, that measure that I just shared with you, was a significant predictor of internalizing. Interestingly, when we predict suicidality, stigma still remains. Executive function skills themselves became a predictor of suicidality, and that's the Ray score. And then independently, those executive function gender-related barriers was the largest predictor, even more so than stigma, in a mixed sample of autistic and non-autistic transgender youth. So these are things that we think about in clinic now, ways that we can immediately begin to support transgender autistic youth thinking about the executive function challenges. Just going to take a look at the time. We have 3 minutes. Okay, that's enough time. So I'll share with you one more clinical tidbit. This is a program that we developed, which is, I would say, a support group, clinical therapeutic group combo for transgender, gender diverse autistic adolescents. And this started with actually a few families years ago who said, are we the only ones? Can we meet other families? My kid feels like he's the only one in the world who's autistic and transgender. And at that moment, it hadn't even occurred to me, I don't know why, maybe I was very young in my career, that I should bring families together. And as soon as we did, there was a magic. Oh my goodness, I've run autism groups, but these kids were bonded at a level like I've never seen because they shared 2 things. They shared autism and gender diversity. And it's not that our groups were easy. Of course, we have all the autism pieces of not wanting to be in groups or being overwhelmed by groups, but there was a quality of connection. And so we realized that we really needed to learn from our young people. How can we run a program where you can be together and grow together and explore your gender together? And so we put it back in the hands of the kids. And over several years of being together in groups in different cohorts, we collected data from them on how best to run this program, and they really designed the program themselves. And it continues to run today, and we continue to tweak it as we learn more and more from the young people of what they need from the program. And so in this program, you can learn more about it if you're interested from this paper, which is way too many authors, but that's great to have all those perspectives. But we focus very much on creating a positive social interaction to motivate the young people to attend, because we know this is a lifeline for so many of these kids. And so unlike other groups where there's a discouragement from social connections and friendships, we really have kind of realized that we have to move in a different direction, because sometimes this is the only other group of transgender autistic people these people could even meet in the DC area. We welcome all identities. It's not just a trans group. This is a very important part of the design of the program, because we knew some of our kids wouldn't be trans always. We could see from those trajectories that if it had been a trans only group and a kid realized that they were cisgender, then the group could push them to continue to affirm an identity that didn't fit for them, or they could feel excluded from their friendship group, their bonded group. And so that's a really key distinction from many trans groups, that we're very clear in all identities being welcomed. And we developed a set of scripts with the young people that indicate that gender can be flexible or fluid or stay the same. We've seen in this group that kids find that they can explore different aspects of their gender. And some of our kids in the end say, you know, I'm not transgender, and they're welcomed still in this community. So just a little bit about some of our visuals. We love visuals because many autistic youth respond, and so lots of pride flags. This is a big part of our group, is counting the pride flags, labeling the pride flags, determining which pride flags are not on the list. Very popular activity. And then going through many different genders, including changing from one to another, that's welcome. And of course, these are autistic youth, so many of them are focused on these kinds of social justice qualities that are so beautiful in the autistic community. And of course, they wouldn't reject someone who is no longer transgender. So that becomes a big part of that group. I think we'll finish there. Oh no, I have one more thing. Another piece that was important to the young people was to meet role models, because many of these autistic transgender young people had never met other transgender people. And so we have visitors coming to the group to talk about their gender journeys. And we have lots of different gender journeys represented. People who are transgender, people who are more masculine but cisgender, people who have changed their mind over time, and the young people can ask them questions. We also provide gender-related style coaching for those kids who struggle with sensory or executive function aspects of gender, and then that speech language therapy where the trans youth can work on their social communication and also at the same time explore a different placement of their voice, if that can help them reduce their gender dysphoria a bit. And with that, I think I can stop and we can see if there's some questions.
Sure. Can you go ahead and unshare? And yeah, there's a bunch. I'll start. A bunch of people had direct messaged me questions, and there's some in the chat. So I'll try to get through these if we can. So one of them that came through was, it's kind of a general question. So if you can summarize, do you have any advice on how to handle the parents? So a lot of times in our diagnostic clinics, we have parents alluding to what your research showed, where it's like, oh, my child is autistic, but they're also not exploring gender, or vice versa. Do you have any words of wisdom on how we can help manage those parents?
Yeah, so for us, the only way that we can really do this is through an ongoing relationship with our parents, that we need to have parents in supportive environments that are open to possibilities, learning the skill of not knowing, learning the skill of waiting and being okay, is so important with this population. I think hearing from someone who has done a lot of this work that a lot of adults are autistic and transgender, you know, for some of our more academic parents, sharing that warrior study, that is really quite convincing, and to talk through that. Some of our parents actually bring in articles and want to talk about it. The other thing that has been helpful for us, which I don't know can be recreated in all of your clinics, but just having the parents be together and talk about their experiences. The parent support group I didn't talk about, but parents talk about these questions like, is it the autism? Is my kid really transgender? Should we start hormones? And making those decisions as with the support of a community is so helpful. I don't know if you can recreate all those pieces, but those are the pieces that are important to us at Children's National.
Great, thanks. Another question, there's several different versions that came through chat to me on this one. The summary is like, what words of advice do you have on the diagnostic differentials? Meaning, how should we be aware when someone presents to us, whether or not they're trans or not, autism or not, BAP or subclinical? Any words of wisdom with regard to how we approach things diagnostically? Yeah,
well, so I would not put transgender in the diagnostic category. I think that transgender is about gender journeys. There is a diagnosis of gender dysphoria, which is a complex diagnosis and controversial. And I know that some people on this call today are contemplating that diagnosis in very thoughtful ways. So the diagnosis, if you were giving a diagnosis, would be gender dysphoria. I would say that autism specialists probably shouldn't give that diagnosis unless you're specialized in gender. You should be consulting with a gender specialist to think about that. The autism diagnosis piece, I think, is complex, and we continue to wrestle with this. I mean, there is just a large overlap in our clinics, and there are blurry kids, and there are kids who claim the autism diagnosis, and I'm not convinced that they're quite over the line. And then what do I deny an identity to a kid? We have a lot of kids like that. And there are other kids who don't think they're autistic, and they're clearly autistic. So I think these are complicated issues. One thing that can be helpful, though, and I think was illuminated in my case study, which is now years ago, I'm going back to the ADI. I think that the ADOS is complicated. The ADOS is complicated for a lot of subgroups of autistic people, depending on age, IQ, gender, and sex. Those things, I think, we're learning about how the ADOS works and may not work as well. But if you can get the early history and the continuity, that to me is the mark of confidence. And we really like looking at videos too. You know, these days, lots of families have videos from the early days. And those can be tricky too. Sometimes you see the videos and you're like, wow, that's a lot of autism things, but maybe not quite adding up. And then do they go in that subclinical category? I didn't share this with you, but the subclinical kids are struggling just as much as the autistic kids in terms of mental health. So I think identifying the almost autistic trans youth is important. Sorry, I could go on on that topic. It's something we clearly think about and haven't really solved a lot of those problems, but maybe that's enough on that topic.
Yeah, no, that's super helpful. Melissa in the chat wrote, is there any research about identifying and successfully supporting children pre-adolescent with autism who are transgender? She notes, I have worked with a couple children with two different trajectories, one positive and well supported, the other was more oppositional.
Yeah. So because it's more rare for the littles to get to us, I don't have a great deal of experience with the 6 and 7-year-olds. I mean, I see a few a year who are autistic and transgender. And the important thing to know about this, and I see one of the national experts on this topic on this call, Peter Danielos, may wish to say other things. But in addition, this margin of puberty and gender development is salient. It's controversial, but it is known that the gender trajectory across puberty for some gender diverse youth is unpredictable, that puberty seems to shift things in understanding. And so any kid who's prepubertal, I think we can't know where they're going to be when they're adolescents. I mean, some kids are like, oh, this kid is trans. It's like, everything is clear. And yes, they are when they pass through puberty. But I've had other cases where like everyone thought that the kid was trans, and then puberty happened and it just kind of unraveled in different ways and things became more complicated. So I would just say that you really need to be working with a gender specialist, and there are not a lot of people, unfortunately, in this country who understand these developmental trajectories. In terms of supportive parents, I mean, you know, there is a whole group of research that would say you support your kid where they are. So if your kid is most comfortable in this place with she, her pronouns, and you know, Ellen is the name, great, we can be in that place and things can develop over time. But fighting against your kid's inner experience and denying it clinically and in terms of research is generally not a good idea. And there's a lot of evidence that you can share with parents about how support and acceptance, even, you know, without necessarily endorsing, I'm ready to sign on to hormones, but using the right name and pronouns is key.
I noticed we have about 5 minutes left that you called out Peter. Peter, did you want to add anything, any words of wisdom or anything you'd like to add to any of this?
I just typed it in there. I couldn't agree more with what John just shared. And the way, I mean, my work has been in the Midwest, in Iowa, with lovely families that are struggling, conservative families. And I've been amazed at how people make room for their children if you kind of stay there with them, especially the younger ones. There's an art to it. And it's moving to see how people try to find a space. And I just love the way you've described this, John. This talk is just, oh my gosh, I'm taking profuse notes over here. We could not have had a better speaker for this. So soak this all up. But thank you. I wish we had much more time. This is so complex and so poorly done by so many people. But not by John.
Yeah, no, I agree. I feel like a fire hose was just attached to my mouth with regard to this. And I'll be honest. I mean, my world is the world of neuropsychology and autism. I find myself just struggling to process the terms that you're using, John, and cisgender, trans. I had to remember, okay, transgender girl. That means they started, they're born. So I'm still trying to capture all that. And so, the group of people on here are greatly benefit by your expertise and knowledge. And in respect of time, there again, if you look in chat, there's so many more questions that people are asking. Everyone's saying it's a fantastic talk. They're looking for research on race and ethnicity and transgender. There's a lot of people asking more about this subclinical population and what do we approach them with diagnostically for autism, and what type of support do we give them. I think for us, this group is all about practical, pragmatic solutions. So just kind of in closing, do you have a sense of, I have a case coming in a couple of months that the parents are struggling with this. The child is considering, whether they're transgender or not and how they're identifying. If we have questions, if we need to send somebody somewhere, we don't have that expertise here. Where should I look? Where should I send people?
Well, yeah, that's a very
you.
Well, maybe to Dr. Danielos. Right. I think that this is actually a nice conversation starter for thinking about autism providers who want to do more of this work, because there are so many of these kids, and the gender providers know nothing about autism in most cases. So I think it just inspires us to create more partnerships. And I would, really love to have conversations with people who are thinking about starting those partnerships between your autism program and your gender programs, so that we have more, experts in safe places for our families, and maybe even thinking, over time of networks across the US of these specialty clinics that can bond together and do much better research, because we have larger ends and different perspectives. I feel sometimes that, the perspectives that I bring to this, it's like, okay, well, these are based on my life experiences, but I'd love to see, what happens when an autism gender program is formed, Peter, as you said, in the Midwest or, in Texas. I think the conversation will be very different. In DC, it's I don't really have to fight with parents, because the parents who come to see me are most generally very affirming. So yeah, I think that's my best answer is let's create more partnerships and become expert together. Thank you.
Yeah, part of what we found the value of this group is pointing people in directions. So, and also like you said, your flyer, please send it to us, Melanie and I. We will send it out to the group and help you recruit if possible. We have, there's over 500 people that access this list in the listserv now across the country, across 7 different countries. So it's pretty extensive. And we've had subcommittees form with respect to different areas of interest like this. A lot of people are interested in this topic. So I can't thank you enough, and Peter, for your words too. Thank you for your expertise. Again, thank you. But for those of you who asked, the recording of this will be up. John gave us permission. It might be a limited time that we have it up there, just in respect for how quickly this field evolves and the sensitivity around this field. But a lot of people, there's so much information, John, that I think I have to go back and watch it again too, just to make sure I got it all. It will reference the articles. And have a slideshow on there. So we'll put this talk recording up within the next couple of days on our website. If you just Google Cornell IDEA, right, Melanie, wouldn't it come up? And then, but if anyone has a question, just email Melanie and I. We're happy to send you the link to the website. It has all of our past recordings on there too for all the different topics. So feel free to access that and make use of all this. But let me just wrap up by saying everyone have a great holiday season. We are meeting the week, Melanie, correct me if I'm wrong, the week before Christmas holidays, on the 20th, right?
Correct, yes. And the date is going to be the 22nd, December 22nd.
So we're meeting, we're meeting Christmas Eve, if that helps. So the Wednesday before Christmas Eve, we'll meet again for the research / kind of a clinic database stuff, which sounds boring, but you guys, I think, will enjoy that too. So John, thank you so much for your time and generosity and your expertise. Really appreciate it. And everybody have a great holiday. All right. Bye, everybody.